I asked 20 doctors to tell me how much money they make in a year. I'll go first. My official salary on paper for the hospital is $90 an hour, but most family medicine doctors earn roughly $250,000 a year.
And I will go second. My name is Dr. Mo, and I'm a general dentist. This is the famous YouTuber and doctor, Dr. Mike, and with regard to the salary that he mentioned, it's actually quite average in relation to that he also went to residency. So he didn't only just get a medical degree, but he went through specialized residency training. If you don't know what residency training means, it means that for a couple of years, you train as a doctor in a particular specialization. Okay, and with regard to Dr. Mike, he gave the average for family medicine doctors, so I assume that's what he specialized in. Now, going back to me, as a dentist, you'll never know. Let's watch.
What's up, everyone? My name is Jake Goodman, and I'm a psychiatry resident doctor in my third year of residency training. The national average for residents.
Okay, so for the actual residents, they are underpaid, or at least the vast majority complain that they are underpaid. Now, there are certain residencies, not only for medical doctors, but also for dentists, because as dentists, we also have residency programs where they pay decently. So not all residents are underpaid, but their argument is that they're underpaid for the amount of work and the amount of stress that they go through. But again, don't forget, it's literally called like residency training, so you're still training.
Is between $50,000 and $60,000 a year. Fortunately, psychiatrists make.
Honestly, that's not bad. That's a doctor who's still training, who's still going through his residency. That being said, he's like year 3 in the residency, so it's on the ladder with regard to like he's near finishing. But yeah,
much more than that once you finish residency training.
You should make much more than that when you finish residency training. So the fact that you're getting paid while you're getting trained, I mean, a lot of residents do not appreciate this. Of course, I'm with if all residents get paid much more, it would be a great thing for me as a doctor and for everyone, but I'm just being realistic. You're getting paid while you train. There are even internship programs, which is also technically a training program where interns get paid. Now, this is more rare as most internships happen in dental school, and to my knowledge, especially in the US, you need to pay to finish or go through your internship training.
When I was doing full-time clinical practice, my base rate was about $400.
Why are they all psychiatrists that he's ringing? So we have Dr. Locke, and he's saying $400 per hour.
The cool thing is that earning $400 an hour allowed me to do things like see a ton of patients or clients for free. And at one point, half of my...
Okay, so now we suddenly shift into the altruistic cause after mentioning the $400 an hour.
Practice, I actually wasn't charging a single penny. I could still support my family of 4 without really too much trouble. The other really awesome thing about people in my specialty is that we tend to work pretty light and easy hours. The average mental health professional actually does about 30 to 32 hours of clinical care per week, which means...
So I hadn't seen a doctor in the psychiatry department who says we have a light schedule and light work hours. Most of them complain of having otherwise. Again, I'm a dentist, I'm not in that department. With that being said, I mean, I'm surprised to hear this.
That our job is pretty like low stress.
I don't know about this claim that a doctor in the psychiatry department would have a low stress job, but again, as I said, I'm a dentist, mostly a high stress job, so I cannot speak for my fellow doctors in psychiatry. However, if you're like a psychologist or in the psychiatry department, you could please comment. Is it true? Do you guys have it? You're getting easy money or what?
How's it going? I'm Dr. Alok Patel. I'm a pediatric hospitalist. So if a child is hospitalized, count on me to coordinate care. My salary is a bit strange.
Pediatric department, I would argue, is possibly one of the most challenging yet rewarding. Why do I say rewarding? Is because I'm talking from a dentistry perspective. The general dentist, or we also have a specialist for like a child dealing with children and handicapped patients, that's called a pediatric dentist. These people play a critical role in the education and guidance of that patient at a very early age to ingrain and make sure that they have the correct oral healthcare habits from young and early on, so they can have a hopefully lifespan of healthy teeth and healthy oral health. But he's a hospitalist, a pediatric hospitalist.
Because I work at multiple sites, but my hourly rate care. My salary is
Does his shirt say hype man? I need to get to one that's the same.
a bit strange because I work at multiple sites, but my hourly rate ranges between $125 to about $150 per.
Again, if you live outside the US and you're shocked with these hourly rates, this is like the somewhat of the norm in the US. Doctors are highly paid there.
Per hour, depending on what type of shift I'm taking, nights, weekends, etc. But I have seen job offers that have ranged between $120,000 per year to $180,000 per year, some higher, some lower. Let's just say that no pediatrician of any type went into medicine for the money. We did it for the kids.
Okay, so to be fully honest with you, there is a kind of, I don't know why he has a green laser on him, but with regard to doctors who say this as a doctor as well, I kind of agree with this. Like, I mean, it's actually, if you think about it, it's not really that much logical, especially if you're outside the US or even if you're inside the US to pursue a career in medicine for the money. It actually does not make sense. There's a significant amount of stress and hard work and like tireless, literal sleepless night for you to get through medical school or even dental school. Dental school can be like a nightmare. I got really high grades when graduate from dental school. I did really well on all of my exams, clinical cases, etc. All of these things. However, medical school, dental school, don't go into dental school or medical school for their money. Because I would argue that there are probably easier ways where you could make money. Not advising anyone to become a TikToker.
My name is Dr. Anthony Yoon, and I'm a board-certified plastic surgeon. Well, according to...
Oh, okay. So doesn't he have that book? Or I'm familiar with this. Most of them are influencers or something. So Dr. Anthony Yoon, he has a famous TikTok as well. Yeah, I don't know. Should he do lip fillers for?
Salary.com, the average plastic surgeon in Michigan makes $239,100 a year. Now, my base salary is close to that without bonuses, but I also...
So the average for dentists, talking US, United States wise, would be roughly around 150K to 170. Not everyone gets paid this. Of course, there is salaries that are skewed toward lower, even lower than 150K. There are ones that are higher than this. What is this determined by? Well, a multitude of factors, including your skill set, how much demand for dentists and for your particular skill set as a dentist there is in the particular area that you are interested in, and so forth. But to my knowledge, plastic surgeons, they're doing well in the US.
Also make extra money via social media, via doing sponsored posts, and I have an online store where I sell my own Yoon Beauty skincare called yoonbeauty.com.
Yeah, that's fair enough, as long as they don't sell snakes oil.
Never ever complain about the money that I make, and I feel very, very privileged to live a lifestyle that I do.
He should tell us some skincare routine instead of money stuff.
Hi, my name is Dr. Antonio Webb. I'm an orthopedic spine surgeon here in San Antonio.
Okay, so orthopedic surgeons are also, to my knowledge, very highly paid. Let's see what he has to say.
Texas. So how much do spine surgeons make? It varies by practice type.
Actually, I need to adjust my posture.
private practice spine surgeon in the South can expect to make once you build a mature practice, which takes anywhere between 3 to 6.
So he's saying building a mature practice, which I would say is unfair to this video because the vast majority of the doctors here, they were talking about things from an employee perspective. At least that's what I understood. He's talking about things from building a practice perspective.
6 years to build can expect to make 7 figures.
Yeah, so he's saying more than $1 million a year. I mean, it's reasonable. Also, dental practices are very lucrative.
I'm Dr. Dana Brems, and I'm a podiatrist, which is a foot and ankle specialist and surgeon. Well, according to MGMA data, the average salary of a surgical podiatrist is about $300,000.
Okay, 300,000. Again, mind you, she is a specialist, so she also went through probably either a residency or some form of specialization training after dental, after medical school. So, I mean, by virtue of this, she's having a high salary afterwards.
I will say, although salary is very important, it really matters whether the specialty you're doing is something you enjoy and whether it matches the work-life balance that you desire.
Hi, I'm Dr. Benjamin Schmidt, also known as Doc Schmidt, and I'm a GI doctor, which means that I specialize in...
So, Doc Schmidt, he also makes really funny videos in relation to GI, and I think he's a GI specialist now.
Gastroenterology. If you break it down by the hour, right now as a GI doctor, I make a little over $260 per hour.
Count how many colonoscopies is this?
I'm Dr. Danielle Jones. Some of you may know me as MDJ, and I am an OBGYN. That means I take care of anything having to do with periods, pregnancy, and the female reproductive tract. How much money you make as an OB-GYN doctor varies widely by where you practice and what kind of practice you're in. I currently work in Aotearoa, New Zealand, which is...
Oh, I mentioned clearly where you practice is extremely important. Because of the demand, population, the average salaries there, the purchasing power, and so forth.
A public health system, and a full-time ONG specialist who's been out of training for 6 years, like myself, would make around $130,000 US in this system, which is significantly less than one would make at the same level in the US or even...
Yeah, so look at how the salaries in the USA are significantly higher. Because this is true if you compare the doctor's salaries in the US compared with, I would argue, the vast majority of countries, if not even all of the countries.
In Australia.
My name is Ricky Brown and I am a board-certified plastic surgeon in Scottsdale, Arizona. How much money do I make? I make enough money to buy 333,333 Happy Meals. You do the math.
I'm an orthodontist. I'm going to be real with you. An aka the dentist online, and I'm an orthodontist. I'm going to be real with you. An orthodontist can make $250,000 starting out as an associate, anywhere up to about $350,000. And then if you own your own office, you can make anywhere from $500,000 up to $3 or $4 million, and even upwards if you own multiple practices. Crazy, I know.
Hello, my name is Ed Hope. I'm a doctor.
So, orthodontists are among some of the most paid dental specialists, okay, along with also periodontists and prosthodontists. Funnily enough, there was that pediatric hospitalist who said a bit ago that people in the pediatric department, they're not getting paid a lot. The pediatric dentists, most of the time, they do not make as much as the orthodontist and prosthodontist. So the prosthodontist is the one dealing with implants, crowns, bridges, and these things.
Working in the emergency department over in the UK. I'm currently a locum doctor, which means I book shifts as and when I want them.
So locum doctor, as he mentioned, this is a UK term, and what it relates to is that these are the doctors that would make arrangements with hospitals and healthcare facilities at specific periods of times to see a patient. So to my knowledge, they don't have a fixed schedule normally, unless if it's the same time recurring, I don't know, but this is what a locum doctor is.
and still quite junior too. And as such, my day rate is around £400. That's around $500, although a night shift would be around a third more.
Honestly, it's not bad.
My name is Dr. Sanjay Juneja. I'm a hematologist and medical oncologist, basically specializing in blood disorders as well as cancers and how to treat them. As a medical oncologist, depending on what system you're in, some private practices get paid for literally the things they prescribe and how much they cost, versus other systems where you get paid just for what you see regardless of treatment. I like the latter because it kind of keeps you clean from thinking about cost as it relates to treating patients with cancer, and generally those don't pay as much, likely somewhere between $400,000 to $500,000 depending on where you are in the country.
Did he just say not to pay as much and then throw a $400,000 to $500,000 salary?
Hi, I'm Dr. Siobhan Deschauer, also known as Violin MD. I'm an internal medicine and rheumatology specialist. Well, right now I'm doing temporary locum work, so I'm not the best example, but...
Why am I directly just looking at people's teeth like every single person that I talk to or react to? Just some dentists.
The average Canadian rheumatologist who's working
I don't even remember what specialty she said because I'm just looking at the teeth.
full-time makes about $250,000. Then
Looks like either some aggressive whitening or veneers as she had done.
subtract about 30% for overhead costs, and you've got $175,000 to $200,000 before taxes.
What up, my name is Dr. John Patton, Doc JP3, and I'm a board certified anesthesiologist in a regional anesthesia and acute.
People in the anesthesia department, they do have a great salary, and not only in the US, and to my knowledge, even outside the US. However, that being said, I think the anesthesia specialist has his job contains significant risk, or at least that's how I personally feel about it, because they're in the operation theater for multiple operations a day, and they need to make sure all the vitals, meaning like your heart rate, your breathing rate, all of these things are fine. But not only this, if there's an emergency in the operation theater, or like the blood pressure significantly drops, or the breathing rate is, some issue happens with it, they're like pointing fingers at the anesthesiologist.
Pain medicine specialist. Sometimes people hear of the E-road to success or road to success. The E-road to success is thought to be the subspecialties that allow for you to have a better lifestyle.
So is that true? I mean, I could say for radiology, and let's just see what are the ones: ophthalmology and anesthesiology and dermatology. I would say the last two are radiology. These almost sure they make a great salary. About emergency and ophthalmology, I'm not certainly sure, but probably they do well.
The subspecialties that allow for you to have a better lifestyle. When we are in residency, when you factor in the hours that we work and the amount that we're making, it comes out to be less than minimum wage. So now,
yeah, so the resident doctors on average, I think he's just showing the minimum wage, but not all of them make this rate. It really depends. Again, I'm not against residents or anything. All I'm saying is there are still doctors in training, and yes, they do work very hard, and they work long hours, and they do complicated procedures even for their level of training and education. I am all with them, and to have higher rates for residents. However, they are still technically trained.
Now that I'm done with training, I will say that it's really nice to finally be able to make a good living and be able to start thinking about paying back loans.
Yeah, also that phase is temporary. And as he mentioned, unfortunately, a lot of medical and dental students, especially in the United States, they take a huge loan in order to pay their tuition fees.
The bane of my existence, yes, they're still there. Being able to save for a down payment for a house, which is something that my wife and I have been wanting to do for a while. And now that we have a son, being able to put some money aside, and, for his college and whatnot. So that's how I answer that question.
Doctors actually used to recommend these treatments, and I can't believe it.
Okay, that's all for today. Thank you for watching, and